All right. Looks like we are all set. And we have a lot of people joining the webinar. Oh my goodness, they keep coming in. Okay. All right, I think we can go ahead and get started. So, hello everyone. Good morning, good afternoon, or good evening, depending on where you are in the world. So my name is Dr. Pepra Amiel, and I will be your host for today's webinar, which we are calling Stories Behind the Data, Mastering Qualitative Research Methods. And this is being organized by the Convention for Biomedical Research, Ghana. So on behalf of CoBReG, I want to warmly welcome all our participants for joining us from various institutions and professional backgrounds. It's always great to see an enthusiastic gathering of researchers, academics, students who are eager to deepen their understanding of different science topics. Now, before I introduce today's speakers, I would like to talk a little bit about the Convention for Biomedical Research, CoBReG. So CoBReG, or the Convention for Biomedical Research, Ghana, as it is known, is a professional organization that includes biomedical scientists, clinicians, bioengineers, lab technicians, public health specialists, and other people from different backgrounds who are committed to advancing biomedicine and promoting health in Ghana. CoBReG was founded and still works closely with the Ghana Biomedical Research Network, which is its funding affiliate in North America. And what we do is we sponsor and promote a range of capacity building and educational activities, which are mostly designed to link Ghanaian professionals with the African diaspora for mutual benefit and national development. Our members collaborate on different research projects. We have different events that we organize throughout the year, such as this webinar. We have workshops that we organize, and then we have our annual conference. This year, our annual conference will be at the University of Cape Coast. We are looking forward to it. More information will be provided on the website. And so we encourage everyone who is interested in CoBReG or who is part of CoBReG to visit our website, cobreg.com, CoBREG.com, for all information regarding the association. We also have a CoBReG membership, and there's a number of people here today who are already members. If you are interested in joining CoBReG, participating in the activities, benefiting from some of the perks of being a member, feel free to visit our website again, cobreg.com, click on membership and join to become a member. There's a little membership fee to become a member. It's 50 cedis for students and 120 for professionals. That's for the entire year, and you get all the benefits that are associated with being a CoBReG member. So why are we here today? Research is not just numbers. It's about stories, experiences, and the depth of human insight. And this is what lies behind the data that we analyze as scientists. And so understanding qualitative research methods essentially allows us to capture these rich narratives behind our research. contextualize our findings, and ultimately enhance the impact of our work, whether we're in biomedical research, whether we're in the social sciences, public health, whatever scientific discipline in which we find ourselves. Today, we are honored to have two very distinguished experts who will guide us through this discussion. We have with us Dr. Nathan Mensah and Dr. Hannah Taylar-Abdulah. I will tell you a little bit about our speakers. Dr. Hannah Benedicta Taylar-Abdulah is a researcher and academic at the University of Cape Coast School of Medical Sciences at the Department of Community Medicine. She serves as a co-investigator on YCheck. This is a project aimed at improving health outcomes through youth-centered health interventions. Dr. Taylar-Abdulah specializes in qualitative research methods, which she applies extensively in her work to explore health behaviors, community health dynamics, and public health interventions. She holds degrees from both the University of Ghana, the Kwame Nkrumah University of Science and Technology, KNUST, and these institutions have shaped her expertise in public health research. Her work contributes significantly to the field of community medicine with a focus on evidence-based approaches to improving healthcare access and delivery. Dr. Hannah Taylar-Abdulah, welcome. Again, we have Dr. Nathan Kumasenu Mensah, who is a health I always struggle to say this, who is a health informatician and head of department for the Department of Health Information Management at the School of Allied Health Sciences, University of Cape Coast. He holds a PhD in medical informatics from the University of Heidelberg. He has a research career that spanned over 2 decades. Dr. Mensah began his work in 1997 at the Ghana's Navrongo Health Research Center. Since then, he has led and contributed to numerous high-impact studies, including NIH and WHO-sponsored trials. He also served as a data manager and coordinator for a work package of the EU-funded multi-country QUALMAT, QUALMAT project, which aimed at enhancing maternal and newborn healthcare in rural Ghana. Dr. Mensah's expertise lies in the implementation of digital health technologies, such as electronic health records and clinical decision support systems to improve healthcare delivery and patient outcomes. His research integrates both quantitative and qualitative methods to advance the adoption and effectiveness of digital health solutions. We have very, very experienced people with us here today. Welcome, Dr. Nathan Mensah.
Thank you, Nana, for that elaborate introduction.
We are honored to have you. So it appears we have quite a number of people attending live right now. So I will hand over to Dr. Hannah Taylar-Abdulah, who will start us off with the presentation, and will be followed by Dr. Nathan Mensah. And then when they are done, we would allow for questions and interactions with attendees. If you're attending right now, you will notice on your screen that there is a Q&A section in your Zoom app. If you have any questions while they're presenting, feel free to leave the question in there, and after the presentation, we will have it answered for you. So Dr. Taylar-Abdulah, I'll hand over to you.
Thank you, Nana. I know that's the name you want to be called. Nana, you're in Kumasi, so you want Nana. Thank you so much for the elaborate background description about me. I'm so grateful. So we'll proceed immediately. I will talk about, this is a presentation outline that will guide our presentation. I will kickstart right away with what exactly is qualitative research. I know a lot of scientists would want to go into the quantitative bit of it, but qualitative research is equally an important approach to doing research, especially if you want to find out human experiences, explores human experiences, behaviors, and meanings through non-numerical data. Whilst quantitative research will look at the what, qualitative research focuses on understanding the why and the how. So the reason behind the figures, the p-squares that you present, and it uses variety of empirical materials. We can talk about case studies, personal experiences, introspective, life stories, observations, quite a number of them, to describe routine and oftentimes problematic moments and meanings in individual lives. So mostly, whilst talking about the whys and the hows, it talks about the lived experiences, what actually the individual or the phenomena says, the explanations behind probably the figures. This is an elaborate definition by Nelson et al. Way back in 1992. We can think about it. So let's zoom in. For those of you who are quantitative researchers, let's look at a little bit of differences between qualitative research and quantitative research. So we'll talk about the purpose of qualitative research and that of quantitative. So here we are looking at meanings, experiences, and social phenomenon. So basically, if you are a scientist and you want to find out the causes of probably cancer, you've done your laboratory investigations, but then want to find out other things. People can tell you, I know a colleague who does a study in head and neck cancers. Then we'll also find out people's background, probably do a retrospective study to find out what they have consumed in the past, cola and all that. I hear cola, the consumption of cola is a risk factor for cancer. So you find out about that. So we explore people's experiences to find out exactly why the person is in this condition in the first place. Whilst quantitative research would test hypotheses, measures probably variables, and find patterns to it. So what is, and then we look at the nature. Qualitative research is non-numeric. So it's words, we talk about images, we talk about observations. We'll delve into the fine details in due course. And then quantitative research will look at a numerical. So we are talking about numbers, we are talking about statistics, we are talking about measurement. In terms of data collection methods, interviews, focus group discussion, observations, either participant observation or non-participant observations. While that of quantitative research will look at surveys, experiment, taking samples to experiment. With respect to sample size, mostly with qualitative study is we use small sample size because we are looking at saturation, point of saturation is in depth, and so you interrogate a lot of questions. Or normally in qualitative research, the sample size is quite small, and it's purposive because we want the individuals who are affected by the phenomenon. And so we sample them based on what we actually want from the participants, unlike the quantitative study where you are looking at large numbers where you are looking at odds ratios, the p-values and stuff. And qualitative research is also very theoretical. So we have theoretical sampling, which is reaching the saturation period. I've made mention of that. And analysis on doing qualitative study is thematic or narrative analysis, and it's highly subjective. Interpretation is subjective. That of quantitative is using statistical analysis. And then when it comes to research design for qualitative research, it's more flexible. You look at emergent theory, it's really iterative. And then, of course, with quantitative research, is structured, very structured and highly predetermined, because you set yourself your hypothesis and you collect the data based on that. And our outcomes for qualitative data is rich, detailed insights, and descriptive. And for quantitative research, there's at the end of the day, there's generalization, and then we look at significance level, your p-value, the odds of an event occurring. That's what we aim at reaching when using quantitative. And then the researcher's role for qualitative, the researcher is immersed into the study, so actively engaged in the study. There's a lot of reflexivity, and then again, the researcher can also influence findings because the researcher is immersed into the study. And so sometimes there's subjectivity here, and most of the time there's subjectivity. And then when it comes to quantitative research, is highly objective, aiming for neutrality and sometimes separation of data from the researcher and the data itself. And for tools that I use, there are also different tools that I use for each of the research approaches. NVivo, there are quite a number of it. Atlas TI for quantitative, we use SPSS, Stata R, Excel can also give you some quantitative data. And of course, we talk about the approach of qualitative research is highly inductive. So it's data-driven. Theory may emerge from the data. So you start from the general and hit to narrow. And then from the you start from small and then you openize, like the pyramid type of research where you start from the tip and then you come out. And then for deductive in quantitative, you start from general and then again, you also move on to test the hypothesis. And then the focus is subjective meaning. So subjective meaning, individuals' experiences are highly subjective. So what participant A might give you will be different from what participant B will give you. So the meanings are highly subjective, and it's based on individual experiences. That is not to say that in quantitative study, individual experiences don't matter. They really matter. It's just that we delve deep into the individual human experiences. In quantitative research, measurements are objective and they are quantifiable. So it's quantification of variables. Presentation of findings is narrative, descriptive. We use participants' quotes, extracts from the participants as a result of the transcripts, and use it as to annotate the report. And then with respect to quantitative graphs, charts, tables, and statistical summaries are used. Time frame. Sometimes quantitative studies can be time intensive, especially because of the engagements. You need a lot of time to do interviews. When you finish, you have to transcribe the interview into Word. When you finish, you also do the analysis. So it can be time consuming. And then with quantitative studies, it's often quicker. Data is readily available. So comparatively, qualitative studies are time consuming. But of course, when you do it over and over again, you get used to it and you are good to go. In qualitative studies, findings are often specific to the phenomenon in context. So you can't generalize your findings. You can only generalize it to the people you studied. But of course, in quantitative studies, you have a broad generalization across populations. So that is very important. Right. So combining qualitative and quantitative methods is one thing. For me, in my research, when I started graduate school, all my theses have been mixed method, and I've had good feedback from external examiners and even my supervisors. So combining both methods is what we call the mixed methods research. And it's very, very important because one is able to leverage the strength of both to provide a more comprehensive understanding of the research problem. So sometimes you have what we call triangulation. So again, we'll talk about that in due course. And there are approaches to these mixed methods. And here we'll touch on two of them. There are quite a number of them where we have the sequential explanatory study. You can start the first phase of the research with qualitative, which will help you to contextualize the quantitative results. So first one, you can do a survey first and later do the interviews, or the other way around. That is a sequential explanatory design. And then we also have the concurrent design or the convergent design. This one, the two sets of data are analyzed separately. So you collect data at the same time while the project or the study is on, you collect them at the same time, and then you merge them during the interpretation phase. So a typical example is the research that we are currently doing on adolescent health. So we are doing screening and then collecting qualitative data as part of the project and collecting quantitative data. So all these are done concurrently. And this also helps in validating findings across different methodologies, which is also very good. So let's look at merits of using both qualitative and quantitative methods. So we talk about the fact that it enhances validity. You can say that it helps cross-verify results and thereby increasing the credibility of the research findings if you do your triangulation very well. And then it also provides comprehensive understanding. So the quantitative will give you a generalization and the ability to identify the patterns in there, whilst qualitative data would offer an in-depth and then contextualized understanding of the why those patterns exist, which is good. And then we talk about flexibility in research design. Again, in recent times, mixed method has gained grounds. Researchers can also tailor their approach to best fits. So if you have research questions that are, there's a need to collect data which is qualitative in nature, and then you can blend them very well. So there's flexibility in blending them where and in that way, you're able to address different aspects of the problem with the most appropriate methodology. So here, which questions will be which approach would be suitable for a particular research question? That is what you do. So again, I'll use Y-check as an example. We are looking at evaluating some of the things, the processes. The processes is all about numericals. A lot of times people are even tired with the p-value, the odds of this and that, the p-value, the likelihood, that's it, blah, blah, blah. So sorry about that. So this is very important. So the approach is that whilst we are collecting data, so the experiments, collecting specimen and testing, we also want to find out the whys and the hows with respect to adolescents, why they are coming for the study, they are part of the study, their experiences with the study, and whether they want it to continue. We are also collecting. And the most important thing is the triangulation, like I said earlier on, using multiple methods to study the phenomenon is essential to help reduce biases that is sometimes inherent in single method approaches, right? So let's look at qualitative methods. What are the methods that researchers doing qualitative studies use in doing their work? So the first one is in-depth interviews. And here we look at one-on-one conversations that allows researchers to explore a participant's thoughts, feelings, perspectives into the fine details. So here, the in-depth interviews could be key informant interviews where you go and look for the persons who really are authority of the profession. You want to elicit information from this person, you go right away. So in the case of the studies that are done in health information management in facilities, those who manage the data at the facilities are the key informants. So you go there and you interview them. They are the people who have the resources. They can express themselves properly in that regard in a hospital setting, even though sometimes you may want to find out other people's perspectives, say clinicians and other biomedical scientists. The key people are the health informatics who manage the data. So you go ahead and interview them. And here there's flexibility to probe deeper based on responses. And then there's also the ability to unravel rich data, personal narratives, and news information. So you are able to get the nuances. And it's also ideal for complex issues such as personal experiences, motivation, or when you are dealing with sensitive topics, especially key informants dealing with commercial sex workers, drug addicts, where you don't want to use other method, but then you are targeting them in that way, where you do your informed consenting and the process ethical issues properly, they are able to give you a lot of information as far as that topic is concerned. And then the second one is focus group discussions. And these are guided discussions that also would unravel group dynamics, which will stimulate conversation and gather a range of perspectives on the topic. So you have a group of people there, mostly for literature, it says between 8 and 12, minimum 8, maximum 12, where the phenomenon you want to understudy, you put them together in a very conducive atmosphere. And this would encourage interaction among participants, and that will also lead to insights that might not emerge in one-on-one interview. So sometimes somebody will share a perspective and then you would want another person to also bring his or her own perspective to there. You can also have that. And it's also efficient, it's an efficient way to collect data from different viewpoints as far as the studies are concerned, and at a relatively short period of time. Again, it's also very essential for exploring attitudes, perceptions, and social norms. So we have participants observation, and here the researcher or researchers immerse themselves in a community or setting to observe behaviors and interaction in their natural context, the environment, natural. Here, biomedical scientists and other scientists, public health scientists can use that to leverage some phenomenon, especially infectious diseases that are highly culturalized. So you go to a community and they will tell you that you see children who are malnourished, yet there are lots of fishes in some pond somewhere, and they will tell you that we don't eat this. So you want to observe them and see how things are in their natural environment. Okay, so again, it provides a deep contextual understanding of a setting. So again, I'll give a typical example where you are looking at community members' understanding of their knowledge on preeclampsia. In our local parlance and in some of the communities they have worked in, when a woman is pregnant and she has swollen feet, which is a typical health condition, they'll tell you that, oh, this person is going to give birth to a boy. And there's no way you can convince them. So you have to understand some of the ways. So when they come to your facility, you are in a better position to educate them without necessarily condemning their perspective on them, but you tutor them for them to appreciate some of these things, especially when you have cases that you can show that this is a typical example of preeclampsia and can lead to death. It's one of the sources of maternal mortality in Ghana. Again, it also captures nonverbal and situational factors that interviews or surveys might miss. So you can go there and observe people going up and down, especially when you want to do something, provide water. You want to observe people go out on a daily basis to draw water. And a lot of times, when there's an intervention for, say, provision of water in communities, you need to get the people involved before citing the location. Is very important. So you can do that as part of the pre-entry, look at all the entry procedures, look at the way the setting, the way community members go about their daily life, get them involved, observe, get them involved before. So this non-verbal cues, situational factors are also a good opportunity to include if there is going to be any intervention whatsoever. Mostly for participants' observation is commonly used in anthropology, where even medical anthropologists use those who have done public health in anthropology. They use sociologists also use it in education to study social practices and cultural norms. So again, in participants' observation, you can have the where you are an observer, the researcher is an observer and is just it's a participant and is part of the day-to-day activity. So mixes with them, the community members, and go about the business as if he or she is part of the community. And that way you are able to immerse yourself. You become part, you immerse yourself, and contextually you understand the phenomenon better than the person who is just an observer, non-participant observer. Distance yourself and you are observing it. And so again, I remember in Osun State, there was this Australian who went to Nigeria to study the anthropological study the gods. If you don't take care, you end up becoming one of them. So this white lady ended up marrying the chief priest of the shrine. So sometimes it's very, you have to know what you are about if you want to be a participant observer, so that you don't end up forgetting about your reason, your objective for being there. So it's very important to, again, we'll look at some of these things. So we also look at sampling, just like qualitative, quantitative study. There's also sampling in qualitative research. So you don't just do it haphazardly. Sometimes people think that, oh, because qualitative studies use non-probability sampling, you can do things anyhow. No, you also have to look at some sampling methodologies that are adopted when doing qualitative studies. So we have one, the extreme case sampling, where you select cases that best fit into your research. So extreme cases, you want to look at the extreme ones, good or poor, or you want to look very good, excellent, good. So in looking at adherence or compliance to treatment, you want to look at those who score very high as far as adherence is concerned, and those who scored very low, so that you look at what are the motivations in that regard. So in my research on looking at adherence among tuberculosis and clients, I was also looking at extreme side, both extreme side, the very good compliance, adherence, and the very poor ones. And then also look at well-nourished children. So you find out from caregivers, why is it that your child is so well-nourished? And you look at the malnourished children too. Why is it that this child is so malnourished? You want to find out, you have to find out the nuances. And then we also have the maximum variation sampling. And this is also used to obtain as complete as possible insights in a certain issue, all variations. So you want to find out, especially when you're looking at stigma. We have stigma in leprosy, stigma in TB, stigma in HIV, stigma in epilepsy. These disease conditions are very, very highly stigmatized. And so we ought to find out what is really, how does stigma even manifest itself in these situations? So you want to look at different cultures. You want to look at male and females. You want to look at rural stroke urban. You want to look at the very sociocultural status. You want to look at those who have and those who don't have. You want to look at educated and illiterate. So these are the maximum variation. So again, in my study on adherence, gender dynamics on adherence, I looked at male and female. I looked at their setting. I looked at educated, the non-educated, and it gave a lot of insight into how stigma is manifested. So for instance, the study found that females adhere, because they don't want anybody to know that they have TB. Among the TB participants, they know that TB is curable. So the female in the study made sure that they adhere to the treatment regimen than the males, business as usual, right? And different cultures. Okay, so among some cultures, they have a lot of meaning as to TB. They say that TB is a death sentence. So if it's a death sentence, what do you have to do? Some would want to say that, oh, it's in this culture, TB is something that is cursed. And so if it's cursed, I have to do X, Y, Z. Others also believe that indeed TB is curable. And then again, among educated people, TB, they knew that TB was curable, and so they also adhered. Among the illiterates, the default rate was found very high among illiterates, and then among the well-to-do to among patients, poor and well-to-do, default rates was higher among poor patients. So you'll be able to do this in your study using qualitative methods. And then we can also look at homogeneous sampling. And here, the focus is on specific information about one particular group only. So you want to find out which group is at risk. So you do maybe country S or country, yes, S. You want to find out death registers. The death registers indicate that suicide among adolescents is on the increase at an alarming rate. So what do you have to do? You want to find out within that group, twice as many boys as girls commit suicide. So you want to find out. And so you want to conduct an in-depth interviews with parents. You want to find out, interview close relatives, teachers, and friends of a number of boys who may have committed suicide to find out the nuances, the trajectories of that. And then we have, finally, we have the typical case sampling, where you also look at description of some cases which are typical and worthy of study. So again, you can look at, in recent times, galamsey has become topical. So you want to find out about health problems of miners, those who go mining galamsey. What are the health implications? I think we all have to find out. Some have talked about a lot, but again, I haven't read so much about the health implication, but then anecdotal evidence suggests that there are skin rashes, some people are getting some conditions. I'm not too sure, I don't want to mention. So if you want to find out the repercussion of mining, typical case sampling is the best option. Or you want to study malnourished children, you use typical case to describe these cases, and this is worthy of study. Right. And then we also have critical case sampling, where we look at those who can make a difference with respect to an intervention you want to introduce. So for instance, if you want to introduce weaning food, first of all, you have to identify mothers who have given birth and their children are between the ages, probably the ages of 4 months and then 6 months, because that's a period where there will be weaning of breast, introduce other complementary feeding. So you want to find out. So again, you develop the local weaning food, and then you think that, oh, this will be affordable to mothers whose children would need weaning foods. And then, of course, you can also look at prior to introducing a large-scale maternal and child health clinics, you may have to interview and observe low-income mothers as test cases. So we are looking at critical cases, those who cannot, you want to make a difference. So those who probably would find it difficult in patronizing maternal and child health clinics. So you want to do test cases. And if they are able to produce and use it, this will also make a difference. It means that the entire group will be able to afford it. So critical cases, we look at the extreme, those who are probably below the poverty line, introduce an intervention, and then we think that quite a number of them, every woman should be able to afford it, or if you make it general, the population that you are targeting will be able to afford it. And snowball, or what we call the chain sampling, it's also another one which is suitable for locating key informants or the critical cases. So you can snowball. For instance, if you want to do something like you need somebody who is below the poverty line and you want to introduce an intervention, you see one person, so, oh, is there somebody within your group who you can refer us to, and then you snowball. And this is very useful in snowballing. It is very useful for critical cases, i.e., where people, it's not obvious to get them. For instance, if you want to study commercial sex workers, if you want to study armed robbers, if you want to study people who take hard drugs, you can use the chain sampling or the snowball sampling, right? So where you get the informants, key informants in that field to give you the data. So all right. So how do we analyze qualitative data? So having taken your data through interview, focus group discussion, mostly it's very advisable in conducting interviews. You should have your notes pad where you recording with a tape recorder. You should also jot down key issues that emerge. Because if you don't do it very well, technology can fail you. But I would advise that if you are doing any interviews, you test your recorder very well. Advisedly, you can have 2 recorders to use so that when one fails you, you can lean on the other. You can, if you have only one tape recorder, you also use a notepad where you jot down something. You don't, as you interview, you might need professionalism to blend the two. It's very important. Recording, asking questions, and recording at the same time. If it's a project, you 2 people can do the interviewing. If it's a project, focus group discussion, for instance, you can have more than one person doing. In fact, advisedly, it is for focus group discussion, you should have more than one person do the question. And then again, you should also have more than one person do the recording and taking down the notes. So having done everything, preparation and organization, you've got your transcripts. You have to convert audio and video recordings into text if the data is from interviews, focus group discussions, and observation. Again, the observation, you don't just go to observe, you should have your observation guide. So you have your focus group discussion guide, you have your interview guide, you have your questions that so having done that, you go ahead and convert all these. Elsewhere, the recorder can do the transcription for you. But because of our accents, some of the words are not, because of the way we speak as Ghanaians, if we are, it's the tape recorder is converting the audio into voice text. You may end up having some words that are so off the way, so you have to do that yourself. So you do the transcription from voice, audio to text. Then when you finish doing that, you ought to familiarize yourself with the transcripts. So you ought to reread the data to gain a deep understanding of its content. Again, revisiting your objective as you go on. You have to, familiarization is very, very key, very, very important as part of the preparation and organization. And then the next is the coding, where a researcher ought to assign labels or codes to the segments of the data to categorize and organize it. So what are the codes, the labels that you think are essential in the transcript? And for that matter, you need to look at it and set it aside. So you put other, you add other in the transcripts, you add the text to it to make it create a bigger picture of it, tell the story. In other ways, tell the story. So when you start with the coding, then you, of course, the second part is to code and categorize them. So you have an open code. Initially, you identify concepts and ideas in the data without a preconceived category. So it's open. You open it, and then, in fact, if you are using NVivo would help you do the coding. So you get a text from it, you paste it into the coding aspect of it openly, and you add onto it. Then we have what we call the axial coding. Here, this is a time for you to group the codes into broader categories and explore relationships between them. What are the relationships between X and Y? Okay, does it really make sense? If you want to find out, somebody talks about my lived experiences in being a co-infected patient. I have HIV, I have TB. What's my lived experience? They will talk about their everyday life, right from the the time the patient was diagnosed with a condition to the treatment regimen, combining two different regimen on a daily basis with respect to working. Some would have to drop out, so they share their experience. So how do you do that? So you have this broad categorization. Afterwards, then you establish these relationships. Whilst there, the next is to focus on core categories and refine themes that align with the research questions. So here, you have your research questions, you develop them, research questions, I sense this. So you focus the categories and align the coding under a particular research questions, or probably talk about themes here, where you talk about themes. And again, the fourth one is where you have your thematic analysis. So identify recurring themes of patterns in the data. How many of them said this, as a result of my condition, I had to stop work? So then somebody talks about the fact that, as a result, when I got TB, HIV, and my family members got to know that I am this, people started looking down on me, and they started stigmatizing me. They won't come near to me. Or this person will say that, as for me, my family understood. They gave me all the support. So you get it. So you hear experiences with the condition. Then you get another theme. Social support has emerged. So you want to find out social support vis-a-vis stigma. So you can really draw the line and tend to put them into themes. So experiences, somebody getting the support, somebody getting less of support. So significant people, I was on my medication, I had to chop. So the effect of my condition, I lost my job. So effect of the condition, you can also look at that as another theme. So you group related codes into themes and sub-themes. And then, of course, you can interpret the meaning and significance of these themes in relation to the research questions. I don't know whether we can give you a study that has been done, and then you can see it clearly. Maybe we will do that in note. And then, of course, you have the narrative analysis. So when you are doing your analysis, you can talk about it, your findings. So you focus again here, that is where you relate the stories and the experiences shared by a participant. So in a narrative format, experiences, from using my HIV, TB study, you can start with the experiences from diagnosis to experience with taking medication, to work experiences, to providing social support, adherence issues, and loss of job, a lot of things. You can tell the story in the way it flows in that order. So analyze how individuals construct meaning through their narratives, from being diagnosed to my current condition. So you get different perspectives. Those who defaulted and are relapse conditions, you can talk about them. Those who defaulted and have started the treatment, you can talk about that story. And then you examine the structure. You look at the content, you look at your reporting. How do we report qualitative findings? How do you report? So you create your themes based on your research questions. So you have your themes, your present themes that you feel that this is it. It fits perfectly in your research questions. You have your patterns, and then the insights must be clear and structured. So it's follow in that order, just like we will present our quantitative findings. So you have your social demographic table. You want to find out, so you have everything in the same way in reporting qualitative. You can have a small a table where you can share participants' demographic too. So you want to have the background so that whoever is reading will know that, oh, this person is this age, blah, blah, blah. You can also find out some of these things. And you can share their initial diagnosis. You can share medication, start of medication. You can share effects on the medication on their everyday lives, share how it affects work, how it affects family relations. You can share social support by significant others. You can share in that way. And as you do the themes, you also have to use, you've talked about it, introduce the themes, and then you start writing. Then the quotes that the transcription, you take an insightful one that fits into it. In qualitative study, you can also have contrary views. So a typical example I'll use here is social support. So social support as a theme. So when you are typing, oh, I receive a lot of support from my family, immediate family, my spouse, my partner, even at the workplace, and then you get some quotes to support it. You can also have somebody who never had anything, in fact, was highly stigmatized to the extent that the person lost their job. So contrary to this person's experiences, this is what XYZ had to say about his experience with respect to social support. So again, you go and the quotes that you generated, the quotes, you use one to illustrate the point, right? And then, of course, whilst you do that, you can discuss the implications of the findings in relation to the research question and existing literature. And it's very important that you can never generalize to a larger population. You can only say that in my study, this is it, the findings, the study that was done in this particular place, this is the findings, okay? And that's the implication. So what are the implications if people are not ready to disclose their TB, HIV conditions, the implication for public health, for instance, as a result of stigma, lack of social support, people hide their status. So what's the implication? If the person lives in a community where there's congestion, densely populated, it means that there's going to be a spread of it. So what do we do? Breaking community awareness, support for persons with HIV, TB, and so we do a lot of stigma studies to allay people's fear that TB, HIV, TB is curable, HIV can be manageable if the person adhere to the treatment regimen. So there are quite, in spite of the nice story behind the storytelling, and there are quite a number of challenges when conducting qualitative study. We talk about data collection complexity, sometimes time consuming. It's very difficult with respect to participants recruitment, especially if you want to use the typical case. Very difficult. And then, so using the recruitment access issues is also very, very critical. It's a huge challenge here. And then because qualitative studies can be subjective, biases could also be introduced into it. So you can even have the researcher biases. So as a researcher immerses himself or herself into the study, sometimes it's very difficult to separate yourself from the study in the first place, especially if you're a participant observer. And then the participants themselves can introduce biases into it, especially when they are unable to give you the actual information that you need. And then come to data volume and organization. So again, where you have large data. I know somebody who has collected data, qualitative data on over 800 participants. 800. And then the data overload, we talk about the coding complexities, how to code all these, sipping through, especially where the questions are a lot. You've elicited a lot of responses, how to code the complexity, getting it varied responses. It becomes very daunting sometimes, but there's a way out. We'll talk about it. And then we can also look at cultural and linguistic barriers. Sometimes there's miscommunication when the person going to do the interview hasn't got any knowledge in the cultural milieu. It becomes that there's miscommunication. And then there's also translation issues, especially if you are dealing with the L1, going to interview somebody like that. Even when you use an interpreter, you still have that challenge. And then sometimes you talk about time and resource constraints. So, but how do we navigate these biases? Let's look at it. We've identified the challenges, but we can navigate them, especially if you are matured, you've done it over and over again, like Dr. Nathan Mensah. Nathan has done qualitative study over and over again, so he's able to navigate all the biases. So we talk about the self-reflection and reflexivity, self-reflection and reflexivity. So you look at there should always be ongoing self-awareness of your role as a researcher, okay, and how that can influence the process. So you have to keep a reflexive journal. And in keeping the reflexive journal, you have to or any device to note it down. So anything that comes in, your thoughts, decisions throughout the study, you have to note it down so that you'll be able to do that self-introspection, you reflect upon it. And then you also have to acknowledge the fact that your personality can have an effect on it. So you have to check your background, assumptions, and then any other potential biases when you are reporting the research findings. And one good thing is that translation does a lot. So you use multiple data sources, methods, or researchers themselves to verify findings. So how do you do that? You collect the data through different methods. So you use interviews, you use observations, sometimes you use documents. And again, you interview multiple researchers in the data analysis. If you are a team and you are working, or you have a group working on the project, everybody must be part of it in the analysis to provide diverse perspective. You know, in systematic reviews, one person cannot do it. In the same way, if you are doing qualitative research, you need somebody to be there to see if your path is crooked, and then you'll be able to do that. And then we have the iterative analysis, where you repeatedly analyze data as new information come in. So as you collect, you analyze and refine emerging themes. When you do that, it's also very easy to go about it. In fact, one important thing that if you are collecting data, qualitative data, you ought to do is that don't wait and pile all the data before you do the analysis. You collect the data. When you come back from the field, you sit down and ensure that you listen back and forth, and get the essence of it and transcribe. That way you are able to picture even the body image. If you did face-to-face, even if it's a qualitative focus group discussion, you're able to look at people's demeanor when they were answering questions, and it reflects. You can in your reflexive journal, you can note some of these things down, and then you revisit early coding decisions. Again, as a team, you have to decide the codes that you use. So you revisit them to ensure that you are at par with everybody. They align with evolving data that are coming out. And you should also be very open to modifying themes and interpreting them as fresh insights comes. Again, that's one thing about qualitative studies. It gives you that room, the flexibility to be able to modify your themes as fresh insights come. You may have set your decide which codes you are going to use. You may have set your objective fine, but then if new insights come in, how do you have to modify the themes to integrate all of them so it helps in shaping your study. So here we talk about strategies that you use to improve your qualitative study. So just like quantitative study, we also look at the credibility of the studies, your findings. So internal validity, again, I've already talked about the triangulation using multiple data sources and researchers to cross-check findings. And then members check and share interpretations of findings with participants. Sometimes, if it's possible, participants will confirm accuracy, especially when you're dealing with key informants, those who are professionals and they have the knowledge about it. When you finish, you can go back to, it's if you have the time, the luxury of time, you can always go back to them to find out, confirm that whatever you collected is accurate. And then you can also do prolonged engagements, spend sufficient time in the field to build trust and gain deeper insights, especially when you're with cultural nuances. You have to prolong your engagement, build trust, gain deeper insights so that they will have confidence in you to tell you more about the phenomenon you want to study. And then you can do peer debriefing. So you involve your colleagues or even experts to review and challenge interpretation to reduce researcher biases. So we also have external validity, transferability. So thick description. How do we transfer? So you have to provide detailed description of the context, the participants, and findings to help to help readers determine if results are applicable to other settings. So is it transferable? Is external validity good? So that's what you do. And then we talk about the fact that you ought to contextualize your study. So how do? You clearly define the research setting. And not trying to extrapolate it to other findings. So this is situated within this cultural milieu. And then we also look at dependability or reliability. So we talk about audit trail, where you maintain documentation of all research decisions. So it's just like you are doing an audit of an activity, you also have to document everything. So you go into a community and you want to gain access, you do community entry, you have to document it. The meetings you have, every processes. In fact, it makes people see your study as something that has not been cooked. Because oftentimes people think that, oh, if it's qualitative, then you can do anything. No. You have to do everything, audit everything. So you have to document them, all the decisions, all the processes, data analysis steps to ensure there's transparency as far as the processes are concerned. And we talked about the reflexivity here too. So keep a reflexive journal to document personal biases and decisions throughout the study. Then consistency in coding. So you have to develop your coding framework and regularly review it for consistency's sake across the analysis process. So whatever it is, again, we want to maintain reliability. Everybody will know that this is it. There's transparency in the data you have collected. So do that. Develop the coding framework and review them so that you know that indeed this fits well across the various your analysis process. The fourth one is confirmability, objectivity. I wouldn't say that it defrays the purpose of the subjectivity of qualitative research, but this is just to, alongside your data, everybody who sees it will know that this is an authentic one, not a cooked data. So you have your data audit as well here to allow external reviewers to examine raw data, field notes, and analysis to verify the conclusions. Again, it has ethical issues. So we'll talk about ethics as far as these things are concerned. But then it makes it objective in a way that in terms of confirming whether indeed the data, everything is there and it tells exactly what you have collected. And then we also have the brackets where you explicitly identify and set aside personal assumptions to maximize biases in data interpretation. So even though you may, a qualitative researcher will immerse himself herself in the data, you also have to ensure that you bracket it so that explicitly you set aside all your personal assumption. And then here too, triangulation works out perfectly. And then we look at authenticity. So do we want to make it authentic? So inclusivity is one, and then critical reflection. So as far as inclusiveness is concerned, we have to represent diverse voices and perspectives in the data to ensure that findings are balanced. Don't go and report only one side because that is what fits into your objective or your research questions. Make everybody's voice count in that order. That's why you can talk about the findings. Majority of my respondents reported this, but others also said this so that everybody's voice is included. It doesn't mean that all the transcripts you are going to include. No, if you do your coding properly, you are able to tease out the best fits. All those one code, everything goes into it. So you are able to tease out to represent the entire people who said that. And that can have your critical reflection. So you also reflect on how power dynamics and relationship may influence data collection and interpretation, especially as a doctor. You are going to collect data. A CEO, no, you have to come to the level of your participants. And that if is spelled out clearly during your consenting process. So you do away with all these power dynamics relationship so that in a settling environment, your participants is able to give you all the information you need for your study. Okay. All right. So talking about strategies, we also look at iterative data collection and analysis. So we've talked about some of these things, comparing data, so constantly or continuously comparing new data with existing findings to refine emerging themes and categories. And then we also have to adjust sampling based on evolving findings to capture more diverse or relevant perspective. So at this point, Doug, can we get, if participants want to ask questions at this point before we continue?
Yes. Well, I think we currently don't have any questions in the Q&A. So I think we can just proceed with the next one, and then we'll have participants ask questions towards the end.
Okay.
So for those attending, if you have any pressing questions, please enter it into the Q&A box, and we will be happy to have it answered for you. So I think we can proceed.
So Dr. Nathan will continue from here.
Yes, sure.
You should just fine.
But he is hosting also. Use my machine. Oh, I switch over.
We can hear you now.
You can hear me.
Yes.
Yes. Okay. No, you use it. You scroll the slides for me. Okay. Yeah. Right. So I'll continue from where she left. I believe you can all see the slides.
Yes.
Yes, I'm talking on the ethical issues that arise during qualitative research. First one. Informed consent. Good. And so just like you do in quantitative research, ethical issues are very strong and important part of qualitative research. And in fact, I would say that ethical issues are more prominent, and they require a way by which you have to build trust so that people would be able to give you the information you need. So we will talk about the informed consent. And first, you have to build that trust, tell the people what the study is about. They should believe in you, and then they should voluntarily give you information, okay? And then they are participation. And along the line, even if things change, you need to update them. Maybe how you initially plan the study to go and it deviates, what you should be able to update your participants so that they are always abreast with the information that they will need to be able to make decision. Because it's not right for you to ambush the participants. You give them minimal information, and then because they volunteer to give you information, you forget about them. So in building trust is important. We will say that it's one of the best practices that people voluntarily trust you and then open up to you and give information, knowing very well that most of the information that you are getting, either by recording it, what they have given you the permission to do so. And in qualitative research, it is also very, very important to ensure confidentiality and protect the privacy of people's information. And so we talk about anonymity. And if I trust you and I give you information, that information is only for your own consumption, and therefore you should be able to protect it to the maximum so that it doesn't get to a third party. Even if you want to share part of the information with a third party, then what you should do is ensure that that information cannot be traced back to me. Okay, I give you an example. You are a biomedical scientist. Maybe a researcher comes to you and then you open up and talk. But many times we know that what the number of biomedical scientists in a particular hospital is few. Maybe you have only one or two. And so when you say you talk to the chief biomedical scientist, it means that already when we identify the facility, then we can know who granted you that interview. And so sometimes you need to anonymize the person's identity, and then also quite be sure that if sensitive information are involved, you suppress the identity of the people so they cannot be identified. And all that is important so that there is no risk of disclosure of information. Whilst at this, you are always thinking about the participant safety and well-being. It doesn't mean that once I agree to grant you an interview, then it means that I cannot stop, okay, or I cannot decide not to continue. Okay, so whichever way it is, like I said before, if the intention of the interview was to last for 15 minutes and it is going to last longer, it is just appropriate that you ask the participant if you can continue. Whilst at this, you should always try to minimize harm and then provide support as much as possible. Having said that, this support should not be in such a form that will coerce the person to or influence the person's decision making. At all moments, the person's voluntary participation should be ensured, and his autonomy should also be ensured. That is his ability to make decision. It shouldn't be influenced by the support you provide. Ethical issues are also very sensitive issues with the border on the researchers' ability to also balance together with the participants that are involved. For example, you can go to one cultural setting, and even the way you greet the people, what will mean that they will accept you. Okay, and also the way you relate with them would also mean they will reject you. So you should be culturally sensitive. When Hannah was talking, she mentioned that when you do community participation, first of all, you have to ask the opinion of the people. You will have to start from their chiefs and others. This actually shows respect to the people's cultural sensitivity. At no cost should you try to assume that as a researcher, you are superior to the group or participants that you are soliciting the information from. You should do that openly and communicate clearly without any misleading information. And so many times, the ethical principle is that you should communicate in simple terms. Don't use jargons that will make the people misinterpret your words or even mislead them. And at all times, the benefits that is going to go to the people should be how do you call it, ensured. For example, as biomedical scientists, if you need to take maybe blood sample, maybe for maybe a test, RDT test or something like that, you should be able to tell the participant that you are going to prick and take these milliliters of blood and you use it for this and that purpose. And however, but when I prick you, you feel a little pain, but it will not be too much, okay, so that the person is much in our awareness and then will be able to quite agree with you. So at all material times, you should tell the participant that look, as we progress along the way, if you do not feel comfortable with anything, you have the right to withdraw, and there will be no consequences that will be hurt this thing, especially if I'm a vulnerable patient and I have come and you are using me as a participant, but you should be able to tell the person point 8. The next one. Next slide. Yes, you should be able to tell the person that the person has the right to withdraw. Okay, and sometimes it is really difficult. People will claim they forget, but you should always respect that without the participant giving you the most important information, you cannot come to the right conclusion. So, in health research, the most important thing is that we respect our participants, their right to withdraw or remain to participate in the study. And that should be our cardinal barometer that we always watch. If maybe you are pricking the person and you see that the person is too much pain, it is not done because he agreed the first time, and so you take advantage of that. You can stop because you know that the person is in pain. Okay, so as health research has shown, whether you are conducting biomedical research or social research, the issues of ethics play very cardinal role when it comes to the biomedical research. In fact, there is double scrutiny when it comes to even what you are going to do, okay, and you must be able to explicitly even explained all component of it. For example, if you are taking 5 milliliters of blood, you have to be able to convince you with a reason why you think that amount of blood is enough to do what you are going to do and not lesser. Okay, and at no material times you want to take extra sample just because your participants have provided consent. And so once at it and you want to do research which should be published, it is important you seek ethical approval from ethical approval from the appropriate institutions, like the institutional review boards. Okay, so in trying to ensure informed consent, it is important also that at all material times, the consent form, it's either signed, okay, that is if it is a manual one, or where the people cannot do this thing, they thumbprint, and they have witnesses to it, okay? Because sometimes you have to even get a third party if communication or language is a barrier, where you have to, through the third party, communicate explicitly to the participant to ensure that the participant understands and give the voluntary participation. And the other aspect is that since you need to ensure confidentiality, you must think about how to anonymize your data. For example, if I'm interviewing patients, okay, and these patients have sensitive issues like that can be used to stigmatize them, then I don't need to identify them by their name. I can identify them by codes. Okay, and even the sickness that has brought them there, if it is HIV, we can identify the disease by a code, so that eavesdroppers will not be able to link the information together to associate with a particular participant. And that is why we need to ensure data security. Okay. So in reporting our findings, it is important, and the onus lies on us to accurately present our results, okay, whether it goes in favor of the researcher or not, but the reports that are presented should be very accurate, and it should not be misleading. In fact, some researchers, they set out to do something, and if the outcome is not appearing favorable to them, they will want to manipulate it. And in fact, that is what the ethics is about. You have to avoid presenting misleading interpretations. We have already talked about cultural sensitivity and then protection of anonymity. Now, when it comes to publication of the information too, it is important that at all material time, if people give you interviews, okay, and the interviews can be linked to them, then you must anonymize the institution where the person is located. If it is a hospital, in the reporting, it is important that you don't mention that it is Jekrodia Government Hospital, but you could give it either a pseudonym or a code. For example, maybe Hospital F, okay, located in the Savannah region. In that case, since Savannah region is a broad area and there are several health facilities, that facility may not be easily identified. And then the voice of the participant that you would have used to support your finding should also be anonymized, so that sometimes if the information is sensitive, you could edit it, okay, so that you communicate what the person wants to say, okay, but without revealing the identity of the person. And the difficult part is sometimes researchers, as we are, try to hide our conflict of interest. Okay, so ethically, it is important that at all material times, any issue that will be of conflict to our qualitative research is disclosed. Okay, so in that way, then it means that what you are keeping to the principles that Hannah talked about, that the disclosure of the information, but is to be able to speak to what you are doing, but suppress your own personal biases and interests. We have a few citations where you can refer to qualitative work that have been done purely which you can make reference to and read about it. In applying qualitative research in biomedical research and health sciences, there are a lot of other factors that we need to talk about. Okay, we can use this approach. In fact, Hannah have dealt with most of the things, so I'm just going to mention a couple of them. Like, if you give out medication to what 2 or 3 group of people, and you see that one group is behaving in a different way, maybe the behavior is abnormal and other things, but that is when you want to find out why that particular okay is exhibiting these characteristics. And so qualitative research can be used to unearth what the nuances and the insights that quantitative surveys cannot bring about. We can also use it to collaborate the findings of quantitative surveys, okay, and that has been used a lot in recent times in clinical and social studies. And the last few slides that I want to talk about is collaboration. You may not be a qualitative person, okay, but it is important when you are doing a research, depending on your research questions or research interests, you can invite a person with qualitative background to help. So we talk about collaboration in this respect. And when you do that, it enriches your findings and bring out the most important things that are really necessary to know. And on that note, I will stop over here and then hand over to the moderator, Pepra Ameyo.
Thank you very much, Dr. Mensah and Dr. Hannah. So I believe we will now open the floor for questions, questions and comments from attendees. So for all those attending, if you have any present questions, you can feel free to type it out. If you would like to ask your question in person, simply raise your hand and we will give you access to talk. So while we wait for participants to get their thoughts together and ask the question, I believe what many of us would like to know from the speakers is what inspired your interest in qualitative research? And tell us a little bit about your journey into academic or this professional or your professional research as you are in now. So I think any of you can go first. What inspired you?
So Dr. Hannah will start.
Okay. Okay.
Thank you, Nana.
Yes.
For me, maybe it's my background. And during graduate school, my background is sociology, public health, sociology first. And so being a sociologist from that broader perspective, it was one of the reasons why I delved into qualitative research. I remember at a time I really wanted to do purely qualitative research, and our department said, no, this is an MPhil. You are not allowed to do qualitative studies. So I did mixed method. And that's where I fell in love with qualitative. I realized that I was able to flow more with the qualitative. It made a lot of sense to me, either than looking at tables and talking about p-value. What is p-value? P-value is so overrated. So that is why I fell in love with qualitative research. And then, of course, my study participants were faculty of University of Ghana. And I'll go to this professor's office and he would tell me so many stories about his background, and I loved it. Instead of looking at the figures and yes, no, and that made a lot of meaning to me as a student researcher. And then going to do my MPH, I said, no, even though this is an MPH, I was looking at contraceptive use among adolescent mothers. And I said, no, this one, I can have the data. I did it in the then Dango where's the shifts. I could get the data from the health research, but then let me go beyond the numbers and find out the nuances. And again, I really, really enjoyed it. Really enjoyed the experiences of young girls who were pregnant, sharing so many insightful things. You won't believe it. It made a lot of sense. I'm like going to say, I've ever used contraceptive. No, more likely, no. I said, let's listen to their stories. And they shared a lot of stories, a lot. I still have some of my transcripts there. And then my PhD, I also use mixed method. And my supervisors were like, oh, Hannah, I liked your analysis, the qualitative analysis more than your tables and your, regression. And again, I said, well, if that is the case, so my students, any students who passes through will do qualitative research. And that's what has been it. Yeah. So that's the journey so far. And I've really enjoyed it. And in recent times, funders will also want you to do something. Now, participatory research, any intervention studies, you have to go co-creation. And co-creation is qualitative. You have to do participatory research at the community level where community members are part of the decision making. And you can't do it better than do a qualitative research. Isn't that interesting? So that is it. Any more questions before Nathan comes in?
That's certainly interesting. We do have a few questions in the chat.
Okay.
I think a few people are asking if you can make the slides available. It seems a lot of people are interested in the slides. But it's something we can discuss later on. What I can say though is this webinar is being recorded and would be made available on the CoBReG website. I think yes, and I think the rest are enjoying the presentation. Richard Donko says a sound presentation from research-enriched knowledge gurus. Great work done. Thank you, Richard. There's another attendant who is asking for more discussion on participant and non-participant observations. I think we can get to that perhaps later. After we hear from Nathan, we are all curious to learn more about his journey.
Right. Thank you, Nana. For me, I would say that I began life as a quantitative person for a long time.
Yes.
And brought me really into I want to have a feel and understanding about the figures that we chunk out as a quantitative in research. My PhD was on purely quantitative, and I have been working on quantitative. But sometimes you get a set of interests in terms of research questions, and you cannot address those research questions purely going by quantitative research. For example, if you want to know why a group of people behave the way they do, yes, you could ask and collect maybe quantitative responses like Hannah mentioned about on a Likert scale, maybe, okay, where we talk about agree, disagree, and get the analysis. But you don't get the feel actually about what's informs them to behave the way they do. And recently, I have come to find out that in evaluating electronic health records that have been established in our government hospitals, I find out that the technology is available, okay, when you ask people, but they don't use it effectively as it's supposed to be. And there is no way by which you will be able to get the exact reason unless you ask people questions in private, and then sometimes they are able to open up to you, because some institutions are there, if you give out questionnaires, especially to health workers, the way they will answer it is also different. But when you build rapport in terms of relationship, trust relationship, and then you ask them questions, they can open up to you. And that is where you get exact insight into reason why they don't do something. For example, nurses may not be documenting their nurses note on a system because of some reasons. And those reasons, they will not tell you if you don't get one-on-one interview with them, where they know that their identity will be protected and their issues can be raised. Thank you.
Yes, that's certainly interesting. It's I think there's something that we face a lot, especially when we try to do research that involves co-creation. I remember there's been issues when we were working on certain projects with USAID, where they complained about how researchers would go into certain communities and would try to impose some kind of development on those communities without actually talking to the people who would benefit. So it's certainly an interesting approach. Okay, we have a few more questions. So okay, we have a question on CoBReG membership. I'll address that later. And so one question says, any challenges in getting data from participants and how these challenges were overcome. And what are some of the support systems that you put in place in any of your research to get the participants' responses accurately? And so I believe this person wants to know what challenges you face in your from participants when you do your research, and how you overcome them, and what support systems you have in place to get participants to respond accurately. I think Dr. Nathan Mensah has mentioned a little bit, but if perhaps you could give us some anecdotal examples from your experience, issues you've faced and measures.
Okay, thank you. To speak to this issue, I will say that the fundamental issue is to build trust. There are always challenges when it comes to qualitative research. And because qualitative research, you are going to talk to an individual, you are going to observe an individual, you are going to interact with an individual. It is important how you do your community entry. For example, even how you dress, okay, can make people have confidence in you or not. And how you ask for permission, okay, can also be a challenge. It can also impede whether the people will take you serious, even if the general permission has been granted. And I give a typical example where I had to collect data from one hospital. For anonymity's sake, I will not mention the name of the hospital to illustrate some of these issues. We had to go there many, many times. Even after getting IRB from the research division of the Ministry of Health. But we still have to make our protocol available to the institutional review board of that hospital. Apart from doing that, now to interact with the people is a second issue. Okay, because they are individual. They are not, you only had permission to get into that hospital. And if we want to talk to specific people, we have categorized the people into senior managers and then users of the system. The senior managers, of course, one, they do not have time, like the surgeons, how do you call it, the physicians and other things, they do not have time. So you have to go in there at a time that is very convenient to them. And that means that many times, what you have to be patient and book time at their convenience. And even if you book time and you come and they are not available momentarily, you have to reschedule. So what all goes into respecting the participants, how do you call it, view. Okay, because for him to give you that consent to be able to interview him and for him to provide good information for you, but sometimes they will stretch you. And that stretch is also part of the challenge that you go through. But when you build the rapport, you will soon see that a time comes, the person opens up to you with voluminous amount of information. Right. I don't know if I have dissected your question.
I think that makes a lot of sense. Respecting the participants is very essential, isn't it? Dr. Taylar-Abdulah, is there anything else you wanted to add?
I think Nathan has said it all.
Right.
Yes, there are challenges sometimes. with respect to availability of your participants to make time for you to interview. But just as he said, if you do your community entry properly, they know that yes, indeed, they have that relationship with you, and that you also have to also respect their private space. You see, I am the one who has all the information to give you. So you also have to respect that time, the time the person gives you, and you go. Sometimes they'll tell you, oh, come today. You go and say, oh, I'm busy today. You have to come another time. You have to respect that. Research is not easy. It is not easy at all. But again, with a rapport and respecting your participants, making the participant know that yes, there's this private space you have to give them. They'll make room for you, and then you can interview them. So that is it. Community entry is very, very key. Very, very key.
All right. Thank you. We have some more really great questions. So before I read this question, I have to mention that a lot of our participants today are students. And so we have some questions from some students. Someone is asking, what advice you will give to those who are undergrads, final year? I believe this person is in final year. So what advice you would give to final year students, undergraduate students who have an interest in qualitative research? So that's question one. I'll read the second one too. And then Gabriel Kweku Agbeshi says, great presentation. Thank you, Gabriel. So Gabriel says most of the tools for qualitative data analysis are licensed. And he mentions InVivi and Atlas .ti. And so as students, are there any means that they can get access to these tools without purchasing them? And they would be glad if you could recommend some sites or groups that address qualitative data analysis using these tools. Let me remind all attendees that we are still doing the question Q&A section. Feel free to type in your questions. We'll try to get them answered. If you would like to ask your question in person, simply raise your hand, click on the raise hand button, and I will be happy to allow you to talk. So over to you, Dr. Taylar-Abdulah and Dr. Mensah. We have two questions here. Advice for final years and
so
tools.
I'll try to take a bite at the question. Yes, for undergrads, whether first, second, up to fourth year, yes, being biomedical research student does not mean that you don't need qualitative research. In fact, you need it more because in these modern times, we are having to do research which actually can impact onto the community that we serve. And so having the ability to complement your research through triangulation or mixed method like Dr. Hannah had made mention of is a great approach. And the question about the tools, yes, InVivo and Atlas.ti, they are, but that does not mean that what you cannot do the research. Okay, the InVivo will help you to organize your work according to teams, and especially if you are dealing with a lot of interviews, like the numbers that Dr. Hannah mentioned about. But personally, quite from my own experience, you could download a Lancet version that can last for 2 weeks. That is a free version, but it will mean that you should be able to do your work within that 2 weeks. Having said that, my personal experience is that sometimes knowing exactly what the way the interviews are, I have been able to analyze 40 IDIs manually without relying on the help of the tool. Because if you conduct the research yourself, like Dr. Hannah was saying, it means you don't need to wait to gather all the interviews. You can start coding gradually as you progress. And then you get to a point where you have saturation. And so by which time you know that there are no new emerging themes. Okay, and in that way, many of the work that you do, which does not involve a lot of participant responses, you'll be able to handle it. But otherwise, maybe you have to consult your university libraries and see if they can provide that support. I'll leave the rest to Dr. Hannah to what.
Yes, Dr.
You've
Hannah, anything to
said
add?
it all. Yes. If you are doing your yes, Nana, I'm here. If you are doing your study, maybe your undergraduate project work, you can use content analysis to do it. You don't need a software to do it for you. It is when you have large volume of data transcripts that you need it. So you can easily do it without. You can do it without software. Right. And then for the person who said he's developed interest in qualitative studies, it's very interesting. You are fortunate. For us in SMS, we teach undergraduate qualitative research. So you are really, really fortunate. I got to know of qualitative studies when I was doing my MPhil, and even that I had to read it on my own. So you are lucky that you have people who have walk through that path and are giving you all you need to be able to be equipped to do it. So take that opportunity and use it. You don't know when you finish and you are working in projects. This time the project, they are doing co-designing, co-creation. They need somebody. So if you are what's a biomedical scientist and you have qualitative research expertise, you are a double asset. So in your CV, you have this. They wouldn't even need to bring a social scientist to do the work for you, even though they need one. You can do it. You have your data and you can peruse it. You know whatever it is that you ought to do. So you'll be part of the experts who can even assess the research work during the processes of data analysis and presentation. Right. So kickstart it, combine, do mixed method if it's qualitative research that you need, especially for those who are public health students or early career public health people. You can take that opportunity and go into qualitative study. My supervisor, Prof. Adongo, is a qualitative man. He's a full professor, medical anthropologist. He did public health. That's the side. So he gets all the projects. He's managed millions of dollars of projects, several of them, several. So that's also another evolving area when you are able to perhaps your quantitative and you add qualitative, mixed method person, you are good to go. Thank you.
Thank you very, very much. We've actually used up our time, so we'll go through a few comments and wrap up. We have an attendee who is some attendees who are so impressed with the presentation and are asking for details of the presenters so they can collaborate with them. What I would say is yes, Dr. Nathan Mensah and Dr. Hannah Taylar-Abdulah, I am sure would be happy to collaborate with you. But become a CoBReG member. We will have information about all of them on our website. And this year, Nathan CoBReG annual CoBReG conference will be held in Cape Coast at the University of Cape Coast, where you may be fortunate to meet Dr. Mensah and Dr. Taylar-Abdulah in person. So that would be an incentive to become a member of CoBReG. Okay. Well, on that note, I think I would like to thank Dr. Nathan Mensah and Dr. Hannah Taylar-Abdulah. Thank you very much for making time to join us and for the very insightful presentation. Dr. Mensah, is there anything you would like to say to our presenters?
It's my pleasure having. Okay.
George was here. I was wondering if he had anything to say, but I put him on the spot, but I think he's a little busy. Anyway, well, thank you very much. So if there were any final thoughts, we'd welcome any final thoughts from you before we sign off. Dr. Mensah and Dr. Taylar-Abdulah.
Yeah, I want to thank the audience for taking time off to listen to our presentations. And thank you also, Nana, for hosting us. And thank CoBReG for providing the platform.
Sure, you're more than welcome, and we thank you for making time for us. Dr. Hannah?
Yes, so we are very, very grateful to CoBReG for the opportunity to also share our knowledge to our audiences. The last time CoBReG was organized as a conference in Cape Coast, two of my students actually presented papers, and there was one lived experiences of CKD patients. I don't know if you remember. So we presented a paper on qualitative studies. And it was very, very impactful. We had a lot of feedback from the audience. So I would say that for those who are interested, there are a lot of free training, online training, free. You can access. Coursera is there. They organize free training. There's also one association, Authorate. So for those of you, go look for Authorate. We have those in biomedical sciences, join them. And those in the social science, public health, and the likes. From time to time, we have free webinars where they issue certificates if you are able to consistently attend all the workshops and then write exams and pass. I've written several of the exams and I've gotten certificates of attendance. So they also share insightful resources. I mean, a lot of research. I've benefited from travel grants from Authorate. I got 1,500 to present a paper in Liverpool. So there are so many of them. So instead of a lot of time for those, the young ones, early bird, explore. Use your time to explore online and you benefit enormously. Thank you, Nana, for having us.
Thank you very much. So you heard it here first. There's a lot of opportunities out there. And later this year at UCC, we'll have the CoBReG conference, and you will get to meet these speakers and more. You get to see their work, what they are working on. This is certainly exciting. If you would like to know more about CoBReG and our upcoming events, please visit our website, CoBReG.com, and become a member. So you can get regular emails and notifications of our events and so on. So on this note, I would like to thank everyone for attending today, all the panelists and all the attendees. And I would like to thank all of you for joining. We are glad to have you, and we look forward to seeing you at our next event. Thank you. Dr. Mensah, Dr. Hannah, thanks a lot.
Thank you, Nana, and thank you,
Thank
everybody.
you. Bye.
Bye-bye.
Bye.